analysis, feeling of being a burden to other people has been identified as motivation for self-harm in the elderly. Next slide. Our report seeks to draw attention to the devastating effects of unattended psychiatric disorders. And we aim to allow physicians to have a high index of suspicion in managing the elderly to be able to identify them. She also said 2 days prior to the incident that patient was restless and complained of disturbances in his head and lack of sleep. Before they presented to us that received INTs, we saw the optic nerve which had about 5 miles. Okay, this shows the picture. The one on the left shows the empty orbit, and the one on the right shows the eyeball with the optic nerve attached. Next, please. We're able to next. We reported the occurrence of auto-indication in the elderly, and this is to draw attention to a possible psychiatric effect. Ophthalmic suspect of a psychiatric effect. This is a rare condition which has not been reported in the elderly. We reported in a female patient who also similarly had meningitis. The patient showed psychiatric symptoms. He was not reviewed by the psychiatrist in our facility. We referred, but he was not to follow up. But this was not identified by relatives, and psychiatric care was not stopped. Next slide, please. We recommend greater attention to the mental health of the elderly. Prevention and management of auto-medication involves collaboration between the psychiatrist and ophthalmologist. I once again invite us to the 6th August lecture by our father, Professor Nwako. Thank you very much for listening.
Thank you very much, Dr. Onion, for a very rare presentation. In fact, this calls to attention of all physicians that our duty goes beyond taking history and doing studies. These patients would have been saved if people, clinicians who have seen him earlier, have taken note of this and ensured a psychiatric evaluation. Now, I can see a medical answer here. Dr. Nwako is here with us. Dr. Nwako, welcome you to this session. Head Pioneer Head and Controller of EMT.
There were 3 box rollers, 7.9% recurrence. In conclusion, levatomyography is a good surgical option for both rollers with less complication. Thank you.
So we'd like to thank all our presenters and the audience that came around to listen to this our session 1. We also have parallel sessions in other places. So we were given 8 to 9, but we are going to take about 5 minutes to interact, have some questions. You might not, if you have questions, I told you to write them down while the talks we are going on. So if you have questions or you have a comment, you can raise your hand.
Okay, let me start the first one. Risk factors and fight environments. Spinal bifida is still largely an area of controversy because there has not been a clear-cut cause-effect relationship. But what we know so far is that among people that take folic acid, that incidents appear to be less, and that is why it is encouraged. But the mechanism is still not very clear in our finding. Then, why is it male? Well, I told you that even in the northern part of the Federation, Mabokuje actually found out that it was called female. Why yes? They were still speculating. Maybe we know that in many of the childhood tumors, not all, but many of them appear to have, childhood malformations. They tend to decide more with male for some reason. But the particular reason, not still conjectural and still speculative. No particular reason can be found.
Considering the caregiver burden, I'd like to know what kind of job skills do you advise for patients with schizophrenia in Nigeria? Because the opportunity we have, yes. So, you have a question for
Well, thank you, Dr. Sunday Oshichi Origi.
When we were discussing the demographics, is there anything mentioned about sex that I didn't pick up? For instance, among the caregivers, any information on sex discrimination?
Thank you so much. The first question, I'm very happy that despite my rush, people still catch some things to ask for or about. The first question says, I should prescription for those who have schizophrenia. You understand? So, illness, that's why as we assess the severity of the illness and measure it with the body on the caregivers. So, all illness depends on the severity. That's why we promote early intervention in all health issues. The earlier you present, the better the prognosis. Because what we ask is like, what are the prognostic factors for schizophrenia? Doctor, 30 years, 10 years. At a point, 20 years time, you like, did this man enter classroom at all? You see, my information test show that the slight preponderance among female, 1.3 to 1, is for stated in the statistics. But the significance does not show much. But still, in our environment here, or studies done in Africa, yes, caregivers are more of women. Mother, unlike abroad, everybody is have equal right of caring for whoever is there. In fact, when they are sick, we go to hospice center, a care center where government take over. Did I answer your question?
But I am sure that today I presented something on medical error. When you do the right thing and achieve, even when you achieve good results. Now, if this thing had gone south, do you think you were protected? And because personally, I wouldn't have allowed my wife to go through that. I'm just wondering if this thing had gone south and there was a story about this. Do you think this protocol you adopted that you have been free in the eye of the law?
Thank you very much, Dr. Okwalem. Remember, I said that when the patient presented, we had to invite the husband. So we had an effective counselor who told them the pros and the cons. All right, and then because they were also highly motivated that they want to have live and healthy babies, okay, and they were also ready to do the things what we prescribe for them, which is that assuming labor starts late in the midnight, can they access the hospital facility for care? And they said yes.
You asked about the root of the neostic. Let me start by saying that this test is usually done with pencil, that is electronic, but it's not readily available. So, neostic weight is readily available. We use 0.5 milligrams, but before that, we have to prepare 0.4 milligrams of entropy ready, because some people may show up with this muscarinic and kinetic effect of neostic weight. Constriction of airway or whatever. So should that happen, you have to intervene immediately. The dose of 0.5 we arrive at that because the dose for adults is 1.5 milligrams. So there's a formula for that weight of the child, and it's 1.5/70 to arrive at the dose of the child. But after the administration of that dose, we find out it's the elementary. So showing that there is a response to the injection. Then the palpebral big fissure again. That's all. And then I think that does it for this session.
Then why someone come against medical advice? Two reasons. Some went for deliverance, prayers. There are a lot of prayers in the houses in the Ondo area. They believe in ministry prayers more than medicine. They can just come and put each other away to go and see a man of God, a minister. So it's a problem. Then number two, when they are told that we need drug like Rosafin, for severe chest infection, and they go and price it, they say no, we don't have the money, let's go. They go and get for prayers. So we have to service their mind. Prayer work and doctor will do his own work. Then Ikoyi is an assumption. I said in Ikoyi because we know that they fit very well with high standard of living. So the children may be robust and obese. So in that case, people there may have a high lipid profile. So the doctors should have atorvastatin, Crestor, and other lipid agents in their cartel management. That's why I put it like that. Thank you.
People above 65 years is living alone. It's important, especially if the person has a medical condition. Where it's not possible, don't close the door. Firstly, don't close the door. Don't lock it. Thank you.
And we should look out for it. But for all of us, it's what we can institutionalize the patient. While we're on it, I think we have to take more mention of it in our patient.
Good morning, Chairman and ladies and gentlemen. I'll be taking the next presentation by the Emeritus of last practice in the teaching hospital in Anambra, Southeastern Nigeria. And the authors in the affiliation. And by name, Emeritus. Because it is an abnormal narrowing and loss of sensitivity of the urethral fibrosis. The pathological changes associated with pictures that actually occur in a spectrum that ranges from simple fibrosis to spongial fibrosis and in extreme cases, extraspongial fibrosis. This patient is present with varying degrees of lower urinary tract symptoms as well as complications like alkali and renal impairment. Diagnosis is usually by means of retrogram, retrocystoscopy, and retrosonography. The modalities of treatment include dilation, use of direct vision internal ureterotomy, as well as ureteroplasty. These three ureteroplasty give the best outcome. So the prospective study done between January 2015 and December 2019.
This was how the sample size was calculated, also with an adjustment for addition of 10%. Now, for the methodology, we want to stage samples. Anambra has about 9 communities. Out of those 9 communities, using simple random sampling. Therefore, we went further to select 2 schools, community secondary school in Aghagbo, and one other school. Therefore, here we got we used residence secondary school. And each of these schools, each of these classes will be 15 students. And most of the participants were between age of 17 to 19. The knowledge of personal hygiene is adequate and is similar to studies, other studies that were conducted last month. 97.8% and 8.5% as well as attitude towards personal hygiene.
Thank you, Dr. Very quick question.
This morning I'm going to present on awareness of the survey on the complete studies among patients presenting of initiative on account of naturally we have to project because we want to implement more what we say audit of literary and global findings in initiative of women with history of building. Now, we look at the objective. We want to find out the patient's awareness of these countries on that top. But and then let the agency practice recruits and the relevant of those patients. So we I work with production now. Some women that are of have undergone some surgeries, and some of those surgeries have been pains, either relevant to or the interest of them. So some of those surgeries include sterilization, and appendicitis, and the rest of them. Surgery involving breach cause inflammation, and one of my process are not due to temporary admission. I don't think hematology inside the uterus or after the uterus, either one or two of them. Now, so the normal history will take. This is very important again. In also get the not a half of the use of surgery patient. You're not going to interpret the images that awareness of the surgery protocol is very important for us to take advantage of the patient so that they're able to communicate. Those who are different allegations and super pathologists to have common among them with very research. And those that look at
usually as a result of genetic or environmental factors or a combination of both factors. The presence of nutrition, mental conditions, malaria, HIV, encephalitis, demographic conditions like increased vehicular traffic, persistent regional civil disorders, some common neurological disorders in sub-Saharan Africa, cerebral palsy, mental retardation, epilepsy, and the rest. We decided to do this study because no study can be done in this environment on this topic to determine the burden of hyperactivity. Among those that have cerebral palsy, spastic hemiplegia was found